Assalamu alaikum and welcome everyone to our second session today. My name is Siddrah. I'm co-founder of Daastan and I will be moderating today's panel where we're going to talk about the concept of e-mental health and youngsters. We have two brilliant speakers already in the house, Dr. Hira and Dr. Siddrah. So I will quickly introduce them and start our discussion. If you have any questions for us, feel free to leave them in the comment section and I'll try to attend to them as soon as I get a chance. So our first speaker today is Dr. Siddrah. She is assistant professor at University of Behavioral Sciences in Nast University, Pakistan, and has done her PhD in psychological medicine from University Putra, Malaysia in 2020. She has also done course in cognitive behavior therapy with hypnosis from London College of Clinical Hypnosis, Asia, and been actively involved in activities related to mental health and research, which is the focus of our talk today as well. And her articles, they are published in various national and international journals, so really highly achieved psychologist. Thank you very much, Dr. Siddrah, for your time today and for joining us.
Thank you so much, Hafsa and Daastan, for inviting me on this talk and on this important issue to talk about. Thank you.
Our second speaker today is Dr. Hira. She is the founder and CEO of MediClinic, an organization that provides medical consultation services to people across the globe. She is a medical doctor and a member of the Royal College of General Practitioners UK and Child Healthcare Information for All. She's also certified by UNICEF and International Federation of Red Cross and Red Crescent Societies in mental health and psychosocial support, and by Harvard Medical School on pregnancy and breastfeeding during COVID-19. She's also a specialist in autism disorders, and it is an honor and pleasure for us to have her today. Thank you very much, Dr. Hira, for joining.
Good evening, Hafsa. Thank you so much for the kind introduction. And I'd really like to take a moment to commend Daastan for hosting the LIDET Fiesta and particularly having the session on e-mental health, which I feel is vital in this era of technological advancements. So thank you for that.
You're welcome. And absolutely. Mental health is so important. And no matter how much we talk about it, it's not enough. But I would like to, of course, focus on the e-mental health and would like to ask you how important it is when it comes to the online community, to internet, to technology, especially in these times where technology is taking over our lives in almost every field. What would you say about it?
So before we dive into the topic of e-mental health itself, let's first take a look at what mental health itself is. Because unlike popular belief, a positive mental health is not only the absence of disease, but a state of complete physical, mental, and social well-being, where one can cope with the normal stresses of life and work productively as well. There are also multiple social, biological, as well as psychological factors contributing to the mental health. And persistent socioeconomic pressures, gender discrimination, violence, unhealthy lifestyle, and even social exclusion have been associated with poor mental health. And the youth of our country, and in fact globally, are constantly facing all of these challenges, mostly without any proper guidance. Unfortunately, when it comes to mental health, this is the most neglected field in Asian countries, particularly in Pakistan, with an estimated 14 million people suffering from mental illnesses, and majority of which are women. And the data I'm referring to is not even updated. And sadly, that is the fact. According to a paper published in the International Journal of Emergency Mental Health and Human Resilience, there's one psychiatrist for every 10,000 people and one child psychiatrist for 4 million children in Pakistan. Imagine that, right? So therefore, the need for e-mental health is crucial to support the youth of our country. And over the past decade, web-based technologies have come together for earlier and better management of common mental health problems. The term electronic or e-mental health basically uses online interventions, and telemedicine for the prevention and treatment of mental illnesses. Now, when I say web-based technology, this is not limited to just using apps. There are websites available for that. There are different, how should I say, well, there are helplines available as well, right? And when we talk about e-mental health, it's not just face-to-face interaction. Seminars or webinars, conferences like these, educational data, awareness programs available, all of these together serve as e-mental health services. So if I'm to sum it up, basically it means the use of electronic media for providing services for mental health. So I hope this briefly covers what mental health is and how does e-mental health work.
It does. I mean, it's such a broad topic, and
Yeah,
there is no precise definition to this. So,
absolutely.
of course, you got an idea of how it is different from the general mental health. I mean, it's part of it, but it's more focused on the technology. So, I would like to know what are the benefits, limitations, and resources linked to e-mental health that you could share with us.
You see, seeing the increasing need for mental health services in the population is posing significant challenges for our healthcare system. Globally, an estimated 264 million people are affected by mental health disabilities issues, and these are also a leading cause of suicide. So, in Pakistan, even no recent data have been compiled to calculate the burden of mental disabilities. There were reports which I was looking into, and since 2012, there was no combined or official data available for topics related to mental health. There are approximately 3,729 outpatient mental health facilities in our country, and only 1% of them are available for children. Now, young people often delay seeking help or don't seek help at all due to the fear of being stigmatized, poor awareness, and lack of youth friendly services. Of course, there are also regional constraints as well as financial. And this is where e-mental health comes in. You were talking about the benefits. So before we get to the benefits, we need to understand why is there a need for this, right? You see, as I mentioned, there are not enough in-person facilities available at the moment, particularly in Pakistan, for mental health issues. So when it comes to mental health, the internet and smartphones have become ubiquitous among the youth and could make seeking help accessible via apps, online portals, support groups, social media, and even telemedicine. So if I'm to list a couple of benefits of e-mental health, that would include its availability at a low cost, or there are actually many services available which are free of cost for patients, not only for Pakistan, but globally. It is convenient and accessible easily. Anytime, anywhere, you can access a mental health specialist right from the convenience of your bedroom. These are cost effective to the healthcare system also. So previously I mentioned how they are effective for the patients, but these are also cost effective for the healthcare system because particularly low income or middle income countries do not spend a lot of, how should I say, expenditure on healthcare, on mental health services. E-mental health also fills the service gap by providing people anonymity. And it's an alternative for people who are averse to face-to-face treatment, right? Because as I mentioned earlier, not only the youth, but many people are afraid of being stigmatized or social exclusion when it comes to mental health issues. So e-mental health services, I think this is one of the most biggest benefit of this e-mental health services that it can provide you anonymity. You don't even have to mention your name. There are services like that when you want to seek some basic counseling, right? There are SOS services available, and you can still get treatment, right? there's also a possibility of early diagnosis and intervention. Now, like I said, there is one psychiatrist available for at least 4 million children in Pakistan. And mental health issues, or basically any disease, is it's better if it's diagnosed earlier at an earlier stage rather than waiting it for it to become chronic over time, right? So this e-mental health services can increase the possibility of early diagnosis and intervention. They can also increase outpatient engagement through reminders. Because most of these services, if you go if you go in person to a hospital or clinical setting, it's totally relying on the patient for follow-up. If they come again for the checkup, it's fine. If they don't, the hospital doesn't chase them or provide them any reminders. And particularly issues related to mental health require them to be motivated. So a great thing about e-mental health services is they can provide you frequent reminders that, hey, you had your last session 2 weeks ago and you have an appointment coming up, right? So it gets you ready for it. However, despite these several benefits, there are still several limitations related to e-mental health too. And one of the key factors is the lack of awareness in the use of e-mental health services and technology, not only for patients, but also the mental health care staff. And the need to familiarize themselves with e-based mental health tools to advise and aware the community on the use of e-mental health services is crucial. So in that regard, it is pivotal for the institutions, our government institutions, as well as private institutions or e-mental health services, to train the relevant staff to use this new technology and also to create awareness regarding it amongst the patients, right?
Right.
One major challenge in terms of all web-based data besides this is record keeping. So to preserve and secure data for patient records, there are several platforms available which can automate cloud migration of data. But e-mental health service providers need to be aware of them as well for better management. Lastly, I know it's getting a bit prolonged, but your question is actually quite vast. You asked about the benefits, the limitations, and challenges. So I'm trying to cover it all up. Yeah, so, well, when it comes to challenges, lastly, I feel a very important thing is the clinical risk. Special consideration should be given to the treatment adherence. Because in a traditional clinical setting, now here comes the benefit of traditional clinical setting, where you can actually observe for physical signs and you can talk to patient in detail. There are several things the patient does not tell you in person. Then there's also family involvement, right? So you get to interact with their family members as well in clinical setting. But what happens is when you're doing it in an e-mental health scenario, you might not get to interact with the family members. You might not get to interact with them in terms of observing their physical signs and symptoms. All you can do is just rely on the data that they provide you. So this can be a challenge for e-mental health service providers, and then they have to be very vigilant about it. But despite all these challenges, the benefits of e-mental health outweigh the challenges. And if we tackle these issues, and these are, like I mentioned, for data, you have automated cloud systems. So you can actually tackle these issues, and they can provide a huge transformation in the healthcare system, particularly for our youth. So yeah, that's about it.
Okay, I mean, we are talking about e-mental health and the benefits and the limitations, challenges, and so on. And obviously, you have worked so much in this field. I would like to know what are the e-mental health interventions and acceptance in global context versus the Asian context, and particularly Pakistan, because we are also very much focused on the Pakistani scenario. So I would like to know, in your opinion, how is the situation right now?
Well, I'm sorry, were you talking about e-mental health interventions acceptance in Pakistan, right?
Yes, compared to the
Okay.
global scenario, or just the Asian context, but focused on Pakistani case study, let's say.
Yeah, sure. We can talk about actually both of them. Uh, like I said, currently there's a lot of negative perception related to computerized and self-help interventions globally, not just in Pakistan or in Asian context, uh, which is actually natural to human attitude towards any new thing that is introduced, right? Talk about any sort of vaccine. Let's talk about the COVID vaccination. Let's talk about polio vaccines. Let's talk about any new thing, a new drug, anything that is introduced the first time in the market. People are skeptical about it. And the large scale dissemination and adoption of e mental health services is progressing slowly. So we need to design frameworks for public acceptability. And there are basically two types of interventions, including self-help intervention, which is usually offered for free and doesn't require a clinician. These include automated reminders, educational articles, awareness messages, generic emails, apps, and games. And secondly, we have human-supported interventions, which are patient-specific and require screening and registration by a clinician. One-to-one sessions and therapy, persistent follow-ups. So both types serve specific purpose, and we need to specify these for the patients. Now, in terms of acceptance of e-mental health, um, there are several factors which have been highlighted in various studies that why e-mental health is not being accepted globally. And one of the most important factors is people doubt the credibility of the program providing it. So credibility is a huge issue. When you see somebody, a doctor, a psychiatrist sitting in a hospital, in a clinical setting, wearing their white coat, it automatically sets up an idea in your mind that this person is specialized to do it, right? However, when it comes to e-mental health, and when I'm talking about the self-help interventions where you're mostly interacting via text, this creates credibility issues within the patient. They feel like, I don't know, anybody can write an article on the internet. Who is
And
this
it's
person behind? Yes, right? So credibility is one important issue. So if we gotta solve this, first of all, you need to familiarize the general public with these type of interventions. And these e-mental health services need to establish credibility, right? Okay. Secondly, I have noticed they might have unrealistic expectations from these kind of services. So when it comes to unrealistic expectations, this is not only for mental health services, this is for all sorts of mental health services, even in a clinical setting. I mean, I think Dr. Siddrah will agree with me on this, that whenever the patient comes to the psychiatrist or psychologist, they just think that after one counseling session, everything's going to be perfect, the life's going to change, everything should get back to normal. And
right.
that is not how it works, right? So again, this is the responsibility of the e-mental health service provider to make sure to set realistic expectations, to let the patient know from day one, hey, these are the services we are going to provide you, and it might take this amount of time. One thing that I noticed in e-mental health services, because I also provide telemedicine and e-mental health services through MediClinic and iClinic, I often see this issue that the patient expects us to be available for them 24/7. Now, you need to understand that although this service can provide you more access and easier access, the clinician still has specific timelines, right? So again, this is also something where you're having unrealistic expectations from the e-mental health service, right? And Yeah, I think lastly, in both globally and also in Pakistan, I think these are the major reasons for this. But one more thing that I'd like to highlight is the issues with technology. I already mentioned that people are not very adept in terms of using technology. If you talk about older people, they have even more issues, right? So I think that is one of the major reasons behind this, that people are a little hesitant. If we can solve this issue and make people more aware of how to access these services, that would be awesome.
Right.
So, yeah, I hope it answers your question.
It absolutely does. Thank you very much. I think most of the people must be wondering why we are not including Dr. Sidra in the talk. It's just that we decided to break the session into parts because both of them have their own expertise. So we decided to first ask Dr. Hira to answer our questions, and then we will move to Dr. Sidra. We also have a few comments from people that I would quickly go through.
Sure.
Abu Bakr Nawaz says, extremely happy to see you guys. Thank you very much. He's one of our regular listeners. Then we have Samin, and she's saying, great topic. Thank you, Samin. We really tried to make this conference diverse and include lots of different topics. Then we have Mohammed Daniel Malik, and he's saying that's actually a really wise solution. Online treatments, anonymity will really help too. And I think we all agree because in most of the cases where people are hesitant to get professional help is because they do not want to be known um,
Exactly.
and
And
stigmatized. So
yes, yes, stigma is also one of the factors.
exactly. And then Sayed Umar is saying super excited to learn from the experts. So I think
Thank
people
you. Thank you, everyone, for the
enjoying
kind
the
comments.
discussion and having a good time.
Yeah,
All right. Dr. Hira, so we talked about technology and that, for example, old people, they are not so um, used to all these new interventions and it can be a bit problematic. I wanted to actually talk about the sleep, which is so important for your mental health, much more than we realize. And
right.
sleep is so important that your emotional side or your physical side gets affected if you do not get enough sleep or not on the right timing. So I wanted to ask you, as an expert, of course, how do you think that technology has affected the sleep patterns of people and therefore the mental health, especially in young people who spend the whole night playing games or watching videos on YouTube or social media and so on?
Hmm.
How do you think that is changing in our society?
Oh, well, technology has certainly brought a lot of positive changes in our life. I'm personally a huge fan of all technological advancements. I mean, life has become so much easier with one click, boom, from one place you're to another world. You can get everything at the convenience of your house. And we're talking about e-mental health too, right? This wouldn't be
Right,
possible without all these technological advancements.
right.
But sadly, everything has its own nuances as well, right? And that comes along with technology too. Sleep is actually greatly affected by technology if used particularly an hour or 2 hours before bed. And there have been several studies conducted globally, particularly by the National Sleep Foundation in the United States, for 85,000 teenagers, which showed less satisfactory sleep in users. When I say less satisfactory, this can include several factors. Less satisfactory would mean you're waking up several times during the night. This would also mean you're not having enough deep sleep. I'll get into these points also later if we have time. Um, and well, it also means that you're not able to fall asleep easily. So all these factors would include, oh, also having nightmares. So all these factors would include less satisfactory sleep. And these are all related to the use of technology about the study, particularly in this study that I'm talking about, right? What happens is that uh, teenagers or adolescents or any person who particularly uses interactive technology, such as games or text before sleeping, this will increase alertness in the user. And that results in waking up frequently during the night. especially when we talk about games, right? So that will make you more alert about your surroundings, and even a little bit of sound can wake you up. Um, there is something, I'll get a little bit into the medical side of this. There's a hormone in our body, actually two hormones. One is called cortisol, and the other one is melatonin. So cortisol is a hormone that is released in our body, which in the mornings, and that helps to keep us awake and alert. And melatonin is the second hormone, which triggers our brain to fall asleep. Now, both of these hormones are released by the presence of light around us. And bright lights delay the release of melatonin, making it difficult to fall asleep. And this has a greater effect in teens and adolescents. I'm not going to go deeper into this, why it affects them more, because again, it will take a long time. But yeah, to sum it up, there are studies which have proven this effect of bright lights, particularly the blue light, which is emitted from the devices such as mobile phones, laptops, computers, tablets. And we have this Kindle nowadays too, which is very frequently used for studying as well. So all of these things can actually affect the release of melatonin, right? Okay. Another factor related to this is called activity absorption, which basically creates distractions. It's like one more chapter. I'm just going to read one more chapter, one more episode of this TV series. That's it, right? One more text, and then I'm just going to say goodnight. But this can turn into that one more, it can turn into several hours, and you just look at the time, oh, it's 3 at night, right? So this is called activity absorption. What happens is this absorption of interesting information or fun information tricks the brain into believing that they should remain awake. So this is also another proven factor related to the use of technology and its effect on sleep. Blue light can also reduce our deep sleep or REM sleep, and that is actually vital for cognitive functioning. So these are several factors that can actually affect our sleep related to the use of technology. Now, no problem. There's no point of discussing a problem if you're not going to provide a solution, right? It's just making people anxious, right? I don't know, many people would be listening right now and thinking, oh my God, I'm doing all these things. So,
Yeah, I am.
right? But believe me, I was actually facing similar issues for a very, very long time until one day I decided that I need to tackle this, besides being aware about it. Because again, the thing was, I knew there was a problem, but I didn't know a proper solution. And of course, in my field of study, obviously, I got the knowledge. So I'd like to share that with people along with a few more tips. So there are actually quite simple things that you can do to change these habits, let's say, that can give you a better sleep. So first thing, and the simplest thing you can do, is turn on night mode on all your devices after sunset. Okay, what happens is it's not very bright light, and it will automatically trigger your brain to release melatonin, the hormone that will make you feel sleep, right? So you're actually now triggering it by yourself. Another thing you can do is you can just put a blue light protection glass on your all devices, including your mobile phones, laptops. You can wear blue light protection glasses that can also prevent migraines and help you with sleep. You can also do one thing, which is moving your tech devices to a nightstand or a table instead of bringing it to your bed. Like put an alarm and just keep it at a distance, because when you're a bit sleepy, it's a bit difficult to get out of bed and go get your device, right? So that would kind of force you to sleep. One important thing is try to set an alarm or a reminder. There are many apps actually for it, and even most mobile phones have this feature built in them. already that you can just turn it on for screen time monitoring. And what else was it? Screen time monitoring, and also to set a reminder that you should stop using your device because you're going to fall asleep in an hour, right? Okay, so these are the tips that you can actually do physically. Now, what else you can do to make up for that time? Because it gets kind of boring. When I started doing this by myself, I would just lay in bed for an hour and I was like, okay, I don't have my phone, so what do I do now? It becomes extremely boring because we're so used to all this stimulus of one more episode, right? So instead, what you can do is switch it with some relaxing activities. Whatever suits your mood. You can try some yoga. You can try some sleep meditation. These are very good things for your mindfulness, also, right? We do so much stuff to train our bodies, but nothing to train our brain.
Yes, yes.
So, yeah, so you can take like 10-15 minutes to do some yoga or meditation, to pray a little silently. You can also do fun stuff if you like it, like me. You can read. Read a book, not on Kindle, a paper book, right? So a
Right.
paperback book, maybe even a comedy one, that would be nice. Listen to some calm music, play it on your phone or on your device or something. Keep it away from you. That's it. So yeah, I think these are some of the tips from my side. Dr. Sidra, would you like to add something to it? Any advices? She's very good at giving advices. So yeah.
Thank you so much, Hira. No, the advices or the tips that you have given, it's like very comprehensive. We call it in our terminologies or in psychology as a sleep hygiene. You have to maintain this hygiene, sleep hygiene, to get yourself into a sleep mode. For the meditation especially, there are different meditations, you can say, available on YouTube and also on many other such stuffs. They are available online. You can use these stuffs to do the sleep meditation. Another thing, like for the sleep again, that Dr. Hera has already talked about, that during your sleep time especially, your brain have to do some kind of wear and tear processes, right? So you must try to have certain positive or meditation kind of things before going for the sleep, because that will help you to remain positive and to do different kind of tasks in your life. For example, self hypnosis kind of things that can be helpful for you, especially before going to sleep. They are uh, very short self hypnosis text available online. You can use it, but again, don't, if you have certain psychological problem, please don't do these kind of exercises without recommendation from the psychologist, especially like a self hypnosis or meditation side of things. Because for example, for the depression, if you go for the self hypnosis, it may be very, have a very um, drastic and very adverse effect on your health, right? So use certain habit, like yoga is very helpful because it is not very harmful for everyone. Yoga is helpful for the psychological, the persons also who are suffering from psychological problems. But for meditation or any such kind of things, try to be use some online stuff which are very harmful for you, or with the recommendation of a psychologist, especially if you know that, or you have observed certain changes in your on moods or mental health, and you have a very keen observer of all these things, and you know that you are suffering from certain kind of mental illness. So try to avoid these things. But whatever Dr. Hera has already shared, to maintain the sleep hygiene while you are suffering from any kind of insomnia or hypersomnia kind of thing because of the technology, try to use all these tips that Dr. Hera has already shared with you. That will be very helpful to get into the sleep. Especially when I talk to different youngsters, they told me that they are suffering from insomnia, and insomnia is like a lack of sleep, and majority have this problem of using technology all the time. And they also lead to other problem, like maybe we call it hyperactive attention deficit disorder. That is also one of the main factor of this disorder, is using of technology all the time. because your attention span is increasing and it is affecting your overall health. So thank you, Hera, for asking this. But whatever the tips that she has taken, just one addition is that if you are suffering from mental health illness, try to follow some self hypnosis or meditation, which is prescribed by your psychologist or psychiatrist. Right? Thank you.
Yeah,
Perfect.
absolutely agreed. You have to be vigilant about all these things as well.
Absolutely. Dr. Sidra, I'll move to you now, and because we talked about youngsters, and you are a teacher, and you are connected with youngsters on everyday basis. I would like to know what is the mental health situation in Pakistan in youngsters, and how has it been affected by COVID? I'm sure they're not going to universities, or they did not for a long time. I don't know if right now they are or not. But how did it affect them? Not just their education side, but also their mental side. And what are the grave concerns which you would say are on the top of the list?
Actually, the grave concern while talking to different youngsters, especially, uh, is that their parents, their elders, they don't have certain understanding of what is the mental health issue exactly. And if they are suffering from any mental health issue, especially if it's like depression or anxiety or any such thing, they are unable to talk to their parents, they are unable to talk to their elders about this problem, because according to their elders and parents, this is not a problem. Why they think that this is not a problem? Because especially when we talk about depression and anxiety, why I'm talking about more depression and anxiety among youngsters, because it is very common in Pakistan. It's very common, although the prevalence, the whole country prevalence is not available. But when you combine the data from different geography and from different studies, you came to know that almost 20 to 60% of our youngsters, they are suffering from either from depressive symptoms or anxiety. And depression and anxiety are certain things that is not like uh, because they cannot communicate it. But in Pakistan, especially in Pakistan, the depression and anxiety, they have physical symptoms. For example, if you are anxious, your palpitation is increasing, your heartbeat increases, and you are unable to breathe, and these kind of things that are related to anxious behavior. And for depression, for example, certain youngsters, they have stomach problem, but all the tests, they are clear, and they used to visit doctors again and again just to treat their stomach problem, but the tests are clear. According to different studies, the stomach problem and many such physical symptoms, they are related to depressive symptoms in Pakistan, but it has not been considered as a symptoms. The reason is that our elders, they don't have any understanding about this. They don't have this concept of mental health issues. Especially when I talked to one of my students, she had diagnosed with major depression. But she said that my parents, they don't understand this thing, that when they talk with her, the problem will be solved. And if she cry, the problem will be solved. But she said they don't have this understanding that I need counseling. I need to cure that. I need to treat it by visiting psychologist or psychiatrist. And especially with relevance to COVID-19, since I'm working on one of the project of what is the mental health problem of adolescents, especially during COVID-19, the problem is aggravated. Why? Because if the adolescent, they have escaped from their homes, especially if it is a domestic violence or a very bad relationship with their parents and the family, when they visit universities, when they visit school and colleges, they have escaped from that environment. But now during COVID-19, they are staying in their homes. They have to interact with their parents. And if they have this emotional abuse, and if they have that bad relationship with their parents, and if parents themselves have bad relationship with each other, that is affecting them so adversely, affecting them that it is not easy for them to communicate that their negative relationship is affecting their mental health. So during COVID 19, if the interaction is increasing between family members, on the other hand, the problem is also aggravating. If the relationship between parents and especially the family members it is not good, then the problem of mental health they are aggravating. Few of my students they have reported that they are suffering from depression and especially anxiety during this phase. Why? Because they have to communicate with their parents and they don't have any escape from that environment. They have to stay there for 24/7 and they have to see these problems and they have to face it, especially if there is abuse, especially if the parents they are very like calling names to them and they're continuously
Exactly.
critical towards them. Yeah, so that is creating an emotional and psychological problems for them. So again, later on I will also discuss with you that how different resources are available for helping these youngsters as well. I hope it
Right.
answers your question.
It does, and I think that would be really useful to talk about the resources. Sayed Umar, he said the parents have a standard line, drama ban karo. Whenever you try to talk to them about something which is bothering you or something you're so scared to share, um, this is usually how they respond. So, of course, that closes every
Yeah.
possibility of extending the conversation and finding a solution together.
One of my students, she said that I think our parents need counseling instead of. They said that this vicious cycle must be broke. That the parents they are training us, and now then when we become parents, we will be the same one. So that vicious cycle must be stopped somewhere. And how it is stopped? To train them first.
Right. No, I absolutely agree. And
Yeah,
I think that's one of the reasons why we are still lacking so much awareness when it comes to mental health in Pakistan, because
yeah,
the
yeah,
parents they are not accommodating, they're not ready to listen, and they just they just stick to the idea that nothing is wrong in our family. None of our daughters or sons can have any problem that is related to their mental illness because they all are perfect.
yeah.
Um, another thing I've heard a lot is that namaz paro sab theek ho jayega. Like you are away from the religion, so why don't you go back to the right track and you will be fine. That's also one of the
Yeah.
big barriers, I think.
Yeah. Here, I just want to add one thing. There are certain neurological disorders which are started during early years of life, especially like autism and ADHD and many such problems. And in our culture, when there is no understanding about it, the the parents they usually take their children to certain maybe shrine or certain they call it Sufi maybe just
Yeah,
to know the concept of evil spirit. It's very common. It's very common, and they don't understand the problem that the person is suffering from autism. Because right now we are unable to have a long talk on this, but the autism have certain kind of features which are very much related to what they call it as a jinn possessions. So
right.
it's like, yeah,
Hard to differentiate. Yes.
yeah,
Um, I'd like to add something about this
Yes,
comment
please.
related to, if you don't mind. Um, See, the thing is, we cannot exclude spirituality and religion from a country where most of the society revolves around it, right? So the thing is, as we are spreading mental health awareness, we need to keep that into consideration too. And I'd say that spirituality does help people in a certain way because it provides them hope, right? People do not, we call it faith for a reason because people have faith in it. They feel that this is something that is going to get it out of it. So I would advise that whenever we are talking about mental health, we should actually find a way to join these things together. You cannot exclude religion, you cannot exclude spirituality from this, particularly in these countries that we are talking about, where this is an integral part of everybody's life, right? So, yes, we can validate their concerns and their suggestion when they say that, yes, pray, it's going to help you, or what was the other thing you were saying? Um,
That they're just pretending, giving excuses not to do
Yes,
certain
okay, so we
things.
can say that, yes, even if the person is making an excuse, why are they doing it? It means there is something wrong, right? Even if
Right.
they're trying to seek attention. That tells why is it happening? There's something wrong at the back end. So, yes, you can seek professional help. These are all triggers or signs that this person needs mental health services. Yeah,
Right.
Yeah. Thank you so much, Hera. One more, sorry, Hafsa, just one more addition that on the concept of spirituality globally, people they are working on it. They are trying to find out the link between mental health and spirituality. So, in the country like Pakistan, we need to understand where is the boundaries between all these concepts, and then use these
absolutely.
concepts. Right?
Mm,
Okay. Thank you
mm,
so much.
And just to add to this, I think it can also
Yeah.
make the situation worse because if you are so strongly believing into something that it's going to help you, for example, praying and so on, and let's say after a course of certain months it has not, um, it just makes you so disappointed that your part, which was a big part of your life, which was your faith, whatever it is not as strong anymore.
totally
Because
agreed. And this is why, like I said, we can't really exclude it, but we need to find a way to integrate these things. As mental health service providers, we need to educate people that yes, this could be a part of something to provide you hope and support, but simultaneously, like any other illness in the world, like you get sick, you take a Panadol for it, right? You take a paracetamol. So you need treatment for that as well. Yeah.
right, okay,
Uh,
Dr. Sidra, I
yeah. Here I
think
want to add just one comment. Oh,
of
sorry. Yes,
yeah,
Hamza.
it's
Just one
such
comment
interesting.
that I remember, yeah, in United States, there are different universities like Stanford and Michigan State universities where Muslim mental health is very common
Exactly.
factors or studying on Muslim mental health.
Exactly.
They are trying to integrate the spirituality with mental health concepts by including different religious scholars into it, and then psychologists. They working together to find out a combined solution for the problem of the patients. Just one suggestion. Yeah, next. I hope it will help you to understand more about it. So it's a wide
The
topic. We need
problem is,
to talk more
Hafsa, this
about it.
topic is so broad that the time is so limited.
Yeah. I think there's some internet issue with
Okay,
Hafsa's.
the time was so limited that Hafsa has left us to talk about it. Just like you two are going to continue to talk
Yeah,
about it, just go on.
yeah,
Something happened to
Hafsa.
my internet. I'm back.
Hafsa, I hope you were not annoyed that we were adding too many comments.
No,
Just one more.
it's such an interesting topic, and I think you can talk forever about it, and it still won't be
Exactly.
enough. But we have to move to the next question.
Yeah, sure.
Um,
Yeah, so,
Dr. Sidra, you talked about staying at home, and especially youngsters who do not have a good connection with their parents or siblings or relatives, because we live mostly with extended families in Pakistan. um, I think what they do now, or what has increased in COVID timings, is that they spend more time on social media than they spend in their real life with their friends or families, in the day, in the night. And I would, as an expert, I would like to know how can we draw boundaries to also protect ourselves. I mean, this is also to protect ourselves that we are going to social media to spend our time, but it's somehow counterproductive because that's also leading to many issues like anxiety, like different complexes, like we start comparing us with people we follow on Instagram or Facebook and all these things. How can we set realistic boundaries where we are helping us but not destroying us?
thank you so much, Hafsa, for this important question. Actually, during this pandemic, we now understand the positive aspects of internet and this technology, especially. Right? Previously, we were of the view that social media and all these aspects they are affecting our lives so badly that our mental health issues probably be aggravated because of use of this social media. But now, because of pandemic, social media is kind of a tool to communicate with other people, to to even talk with other people, especially if you know that initially, especially, and also now, that social isolation is one of the very important aspect for COVID-19 to save yourself from the exposure of COVID-19. And during this social isolation, the important tool which is helpful to communicate with the people is your mobile phones, or maybe this technology, or maybe social media. Now, social media does have negative aspects, especially if you are continuously watching the Instagram stories, and you also know that the food that we used to take the picture and post it on different Facebook or Instagram, it is different from the picture that what we are taking.
Absolutely.
Yeah, and the friend circle, and when we watch, like, when we see that the people, they are out and they are enjoying a lot with their friends, but this is happening just for once probably, but not all the day. So there the comparison comes, when you are continuously comparing yourself from the happiness of other individuals, right? That may create problem and complexes. And in order to avoid this thing, the only important thing that you can do, that you need to have a check and balance on the routine that you are following, when you have to follow and when you have to look into the Facebook, and what are your objectives to use Facebook and other social media. If it is just to see what the other people are doing, definitely it will increase the complexity. It will also increase the anxiety, it will also increase depression, it will also increase other mental health illnesses. When you compare your life being very sadder and sadder, staying at home, and the people outside, they are enjoying everywhere, just by comparing the pictures that they are posting on different social medias, there come the problem, right? But as far as COVID-19 is concerned, I'd said the situation is probably quite different. Probably quite different. Because during this pandemic, the people learn that the unconventional jobs, how the unconventional jobs are helpful for them, how the media is helpful to educate people, right? And the students, when I talk to students, they used to say that their social media interaction is reduced because they have to be online and taking classes all the time, because whenever teacher get the time, they start taking the classes. So they said they don't have time for the social media at that point, but when they are in the class, they have to be in the class. Sometimes they have to switch off their mobile phones. So, and again, I remember one of my very good student, she got job online, and she said that it's a white collar job that I'm doing, and I am earning more than what you are earning right now. And I got it during COVID-19, especially the online job. So that helped her to get a good job instead of going for the clinic and then sitting over there for long hours and waiting for the patients to come in. So she said that now that helped me a lot for getting good jobs and that. So they have positive and it has negative effects. It depends on you where you have to develop or draw boundaries for yourself, how to use the social media, and how to use it effectively for your life.
Right. The last two questions are for both of you. So I would like to ask, what are the e-mental health resources that people in
Yeah.
Pakistan, or I don't know, in Asia can count on if they feel like they need professional help, or they need to talk to someone? What should they do? If there are
Okay.
websites, platforms, I would love to know.
Yeah. Thank you so much. I think Dr. Hira also have certain websites. I'll tell you some of the websites or toll-free numbers or organizations which are available in Pakistan. Number one is Rosen, Rozen. Rosen is one of the non-profit organization, and the toll-free number is also available on their website. You can also email them. It's available 24/7. And the counseling, and again, remember, these are the counseling sessions, not a psychotherapy properly available. If you are suffering from major problems, probably they will help you to find out a good psychiatrist or psychologist to refer to. Another one is, maybe you can write it down. It's DBS telecounseling. DBS telecounseling, TELE. and then counseling@gmail.com. And
Right.
their phone number is,
Sorry for interrupting. I'm just going to add them later on in the comment section.
yeah,
So if somebody
yeah,
missed
please.
this, I will
Yeah.
mention it there. So sorry.
Yeah, so these are certain, sorry, and the phone number is 051 9085 3778.
Perfect.
Right, so these are certain mental health services. Probably Dr. Hera also have certain services, no certain services which are available for Pakistani youth and other people to consult with. So that will help you, and there are various e-mental services available in Pakistan, which is very helpful for the people to approach and get themselves at least a first, you can say, a psychological first aid at the first space to get into that.
Right.
Right, and how it works, you will find it out. They will tell you about that therapeutic contract and everything when you talk to them.
Brilliant.
Yeah, I think
Uh,
we have short. That's why I'm not extending it too long. Yeah, Dr. Hera, sorry.
yeah, I'd also like to add just a couple more resources, as Dr. Siddrah already mentioned. Besides Rosen and the toll-free numbers she was talking about, we also have umang.com.pk, which umang.com.pk. Then we also have taskeen.org, so taskeen.org. We also have sahil.org, sahil.org. Then she mentioned also what, Rosen. Then we also have talktous.pk, TALK, then the number two, and then we have us.pk, talk to us. So these are some of the resources for e-mental health which provide free counseling services as well. Besides that, we have Sami Sai Clinic, SAMIPSYCLINIC. So Sunnyside Clinic provides both free counseling services as well as they have prolonged therapy sessions which you can book an appointment for. And similarly, we have marham.pk, marham.pk, where you can have paid consultation services available. Now, why I'm mentioning the other ones too, because the thing is, we need to have, as I mentioned, for e-mental health services, there are two different types available. One is where you can get self-help services or just basic counseling. And at other times, there are disorders and issues where you need a prolonged therapy, right? Face-to-face or in-person or one-to-one sessions. So
Right.
for that, Marham and Sami Side Cleaning, and actually all of these provide them too. But yeah, they have like more information and more number of psychologists available. So yeah, besides all of that, I'd also mention a MediClinic. So for MediClinic, also we provide free counseling and free counseling and mental health services, and as well as we can connect you to psychologists and psychiatrists across the globe, not only in Pakistan, globally. You can decide and you can choose from the list of the doctors and specialists we provide you. So yeah, that's about it.
Thank you.
You're welcome.
Before I let both of you go, I would just want to ask something which is useful for me, and I'm sure many people like me. How can we balance our offline and online life, which is not just in times of COVID, but also generally? Because I personally struggle a lot. I mean, I think social media is an addiction, and anyone can easily get addicted to it. Um, just when you find yourself addicted and you realize that you are, what should you do as the first step to or first steps to step away and have a balance between your online and offline presence?
Um, well, that is actually, like you mentioned, it's essential to try to find a balance between our online and offline life. Um And like I said, the internet and the technology is so deeply integrated in our lives these days that it's almost impossible to separate ourselves from it. So, as we're running out of time, I'm not going to talk in detail about it. I'm just going to give you some quick tips, perhaps that can help you and um, everybody else who's struggling between this offline and online life balance. First of all, I'd like to mention that you can switch on the do not disturb mode on your devices at certain times during the day. All devices, including your mobile phones, tablets, laptops, they all have this feature of do not disturb. So perhaps just for maybe 1 hour or 2 hours in the evening after you come back from your work, you can just turn that on. You will obviously still get all your notifications and everything, but you can check that later on. So this can provide you some time to, take some time off the internet.
Right.
Um, Secondly, another thing you can do is you can set regular times to do some offline activities. So, offline activities would include doing anything that is not on the internet. So, let's say simple things like you decide that every day I'm going to have tea time or evening tea with my family. So, you set aside 6 to 8 p.m. for nothing else but to spend time with your family, have some tea with them, just enjoy in the evening, right?
Right.
Something like that, not getting on your devices. You can also, like I mentioned earlier, meditate, do some yoga, do some exercise, hit the gym. That is also good for your physical health. Um, Take a walk in the nature, go outside, go to a park maybe, watch other people, see what they're doing. Because of COVID and the lockdown, it's very difficult. We are not able to go outside a lot. So wherever safely you can, even just going to your own terrace for like an hour, just stay there, read a book, or do something, right? Um, Another thing we can do is you can play games that are offline because we are so used to all this stimulus and this information on our devices all the time, particularly from social media, Instagram, Facebook, so much stimulus, right? So you can't just replace it suddenly with something as simple and non exciting as just sitting down and having a cup of tea. So you can replace it with other games such as play board games or maybe basketball, football, chess, whatever game you like. Replace it with that. Learn a new instrument, learn something to do on your own. You can perhaps learn how to play the piano, write something, write poetry, right? The idea here is just doing activities which are offline. Other than that, you can also go for outdoor adventures. You can go for a hike or something, go for dinner with your family, cook something for them if you like, or for yourself. You can paint. There is actually so much you can do. So these are basically the alternative activities that I'm talking about. Now, when it comes to balancing between both of these lives, offline and offline, the first and crucial thing is you need to realize that you have to find a balance. Most people don't because they don't feel the need to do so. So, first thing is realizing it, and then you can take all these actions, right? You have to analyze what is the effect of you constantly being online on your mental health, on the people around you,
Right.
right?
Right.
And lastly, if there is something called as you can say internet addiction or e-media addiction or mobile phone addiction, if you feel like you have something of that sort, please do not hesitate to seek help from an expert. We have just provided you so many free resources, right? Just send them a text. Hey, I have this addiction. Can you help me out? So don't feel afraid to, seek for help. Yeah, that's all from my side. Dr. Siddrah, if you'd like to add something.
Dr. Siddrah, can you hear us?
Yeah.
Okay.
Yeah, I just want to add one thing, that we need to train our children for that, right? And in order to train our children, we have to follow certain routines that will help our children to stay away, because that now, because both parents, they are working, they used to give children the mobile phone even when they are feeding them. So they
Right.
get addicted from all that, right? So it's like if you learn something, it's called as learning through association. You associate your children feeding with certain kind of rhymes or certain other element. From there they got associate their learning from that, and then it will like become a part of their life, and it may lead to the addiction as well. So we need to train ourselves in order to train our children to not get addicted from this media, and that will also cause certain because if they are not involved in any other physical activities, they are only involved. They are only doing that call as using social media or internet or technology. They may have certain psychological problem which is started early in their childhood. So we need to train them from their childhood, right? Instead of giving them mobile phone just to stay them quiet. If they are crying, if they are not taking any food, that is like disaster for them. So we need to train ourselves and our children, so that will help them to create balance in their life, and also for the parents as well,
Perfect.
right?
Thank
So
you very
that's just a
much.
quick answer.
Yeah, it
Thanks.
was
Sorry,
really, really
there's just
helpful.
one more tip I wanted to add. It totally
Yes,
skipped my
please.
mind, but I think it's very essential.
Yeah.
Um, and it's quite simple. You can just download a lot of apps that are available. I would also like to name a few, which personally I use. There's something called Flux, which can help to lower down again the brightness for your computers and table devices. Then there are also different apps, and what is it called? Basically, there are things that you can add to your phones and your laptops which set a reminder for you to take some time off. So that is also one more important thing. I think you can just look it up, screen time aware or reminder or something like that.
Perfect. Before I say goodbye, I would like to add the comments from a few of our listeners. We had Aisha Chaudhry with us, and she said, Dr. Hira, thank you for the tips on sleep related issues. We also had Nadi, absolutely agreed with Dr. Hira. Thank you for this insightful session. And we had Daniel Nasser, and he said, thank you so much, Dr. Hira. Thank you so much, Dr. Sidra, as well, for always
Thank you.
including and giving your side of feedback and expert advice.
Thank you.
Yeah, thank you. Thank you so much, Hafsa. And I'd really like to thank Daastan for holding this session. This is such an important and crucial topic, and I am sure it will create at least some awareness. And it's an honor to be part of this. Thank you.
Thank you so much, Hafsa, and definitely Dastan for inviting us. And again, it's a very important topic to talk about. And thank you so much. We are honored to be a part of this
It's an
topic.
honor and pleasure for me to have this conversation with you. And I wish you all the best with all the great things that you are doing.
Thank
And I
you.
hope we can do something in future together as well on this topic whenever there is an opportunity.
Yeah, sure.
Sure.
Yeah,
Thank you
sure,
so
sure.
much.
Okay. Bye bye.
Have a
Thank
good
you.
evening.
Take
Bye
care.
bye.
And you. Bye.
Bye.
Bye.